Dr. Lisa Salamon joins me now. She's an emergency physician from Toronto. Good morning to you, doctor. Nice to see you. So we have these new variants in Canada, in Ontario, one of them in Toronto. How concerned particularly are you about these variants? Let's start with that Brazilian one.
I'm really concerned about these variants in general. We don't know enough about them. We don't know where they actually are right now. And it's a huge concern, particularly if we start reopening things. We've seen with the UK variant how it rips through long term care really quickly and how it spreads very fast. And so, as schools are reopening today and the potential for some businesses to be reopened, it's very concerning because we don't know enough about them. It could cause a huge risk.
But some people, doctor, are saying, well, our case counts are still trending down, and it's likely that there's more variant out there that we're aware of. So what do you say to that?
Right. So we've been in lockdown, right? So people have been at home. There's a stay at home order. Businesses have been closed and schools have been closed. So we've been sort of plateauing around the mid thousands for a while now. It sort of fluctuates up and down, but around, 1,500 or so. Um, the concern is as schools opening today for many regions in the province. If you have one child with a variant, who's asymptomatic going to school, we don't know how fast that could spread through an entire classroom or an entire school. We've seen in long term care how it spreads really quickly. And there is concern that the rules we've been following with masking everyone as 6 feet distance, that may not be adequate for particularly the UK variant.
And we haven't even talked about vaccines. Again, the same subject we were talking about last week with that race between the virus and the vaccines. Doesn't this show that we need to get people vaccinated as soon as possible in the biggest numbers possible?
Absolutely. I've been saying this all the time. It's, a little while ago, I think the beginning of the month or the beginning of January, when we were seeing so many ICU patients and really sick patients with COVID in the hospital, I at least was cautiously optimistic because we had the vaccine here. We had a plan, particularly in my region where I work, to really roll out the vaccine quickly. And then suddenly we were grinded to a halt where there was no vaccine left. And we've been sitting on our hands for well over a week, unable to vaccinate anybody. So this is really scary as we have all these new variants and we don't have any vaccine. And we're really not sure when we're going to get a significant amount of vaccine, be it Pfizer, Moderna. We don't even know about AstraZeneca or Johnson & Johnson. So we're really in a race to try to get vaccine here before there are more and more variants and before this spreads again.
Dr. Salamon, great as always to talk to you. Thanks so much.